Health insurance is something very important to have, not only for yourself, but also for your family members, because you can't predict when an accident will happen and if you or others will be injured. Do you have health insurance? Hello, my name is Victor Idan Barajas, and some of you are probably asking, why is this relevant to me? Well, about a year ago, health insurance wasn't an issue for my family and I, or something that we worried about, because we were covered under my father's plan. But after my father passed away, my family and I struggled to get health insurance. And since then, I am the only one who is now covered, so that I am able to continue to play college basketball. But with a more affordable healthcare plan, or maybe even a free one, this would not be an issue for my family, and most likely others. According to Sarah R. Collins, the Vice President of Healthcare Coverage and Access, stated in an article from February 2019, the greatest deterioration in the quality and comprehensiveness of coverage has occurred among people in employer plans. More than half of Americans under the age of 65, about 158 million people, get their health insurance through an employer, while about 1/4 either have a plan purchased through an individual market or are enrolled under Medicaid. Healthcare in the US is a financial burden. With its high cost of services, there are significant disparities also in accesses to care by sex, age, race, ethnicity, education, and family income. There are other disparities also, such as distance. Due to millions of Americans that live in rural areas and lack the access to primary care services due to workforce shortages. In that same article from February 2019, Sarah R. Collins also says, in 2018, 8 years after passage of the Affordable Care Act, the uninsured rate among U.S. adults ages 19 to 64 was 12.4%, statistically unchanged from 2016. Despite actions taken by the Trump administration and Congress to weaken that law. There are many things that we can do now to make a difference in our future for what we believe in, such as taking action by voting. Healthcare is something that can benefit all people, not only ourselves and family members. They can prevent a bunch of health issues, hospitalization, and many more. Taking an interest in politics will help us have a better understanding of what's going on around us in our government. Michael K. Guzmano, the Associate Professor and Director of the Concentration in Health Systems and Policy at Rutgers University, stated in November 2012, the government is the #1 purchaser of healthcare services in the United States and also the largest federal government expenditure. This is also something very important for the youth to pay attention on what's going on around us politically, so that one day when they are able to vote, they're able to vote for what they believe in and have a voice and be able to make a difference one day, hopefully.